Good evening. It looks like 6:30, so I'm going to call the meeting to order. And the first thing I'm going to ask is that folks introduce themselves.
Gary Rosen, member of the Board of Health.
Francis Anthes, Chair of the Board of Health.
Michael Parado, member of the Board of Health.
Leopoldo Negron Cruz, member of the Board of Health.
And then I'm going to ask staff.
Tamara Lundy, the Director of Division of Public Health.
Kyle O'Connor, Tobacco Prevention Specialist, Department of Public Health.
Devon Thornton, Environmental Health Coordinator, Division of Public Health.
Emma Stefanski, Environmental Health Coordinator with the Division of Public Health.
Nick Antanavica, Commissioner of ISD.
Thank you. And the guests in the room? Thank you.
Abdul Ghani from Small Convenience Store.
Shurab Khan from Big W Smoke Shop.
Okay, thank you very much. And then folks who are joining us virtually.
Mike Hirsch, Medical Director, Division of Public Health.
Brenda Wright, Principal Clerk, Division of Public Health.
Hi, Amelia Houghton, Chief Public Health Nurse for Division of Public Health.
Desiree Sutton, Business Manager for the Division of Public Health.
Anyone else want to identify yourself? Okay. Then I'm going to, before we move to the minutes of the last meeting, I'm just going to formally congratulate Gary Rosen, who is a member of the Board of Health at this moment in time, but based on the election results, will be moving to the City Council at the beginning of January. Gary?
Thank you, Madam Chairman. I greatly appreciate that, and looking forward to joining the next Worcester City Council, but also it's bittersweet to be leaving the Board of Health, which I've enjoyed for the past 4 years, and hopefully as a member of the City Council, I'll be able to speak up more on matters of public health, and maybe our Public Health Committee, which I will hopefully be on, can have some joint meetings with this Board of Health and maybe do some pretty good things here for the health of the people in Worcester. So I thank you and looking forward to still working with you in some capacity.
Thank you, Gary. I think that we have had some combined meetings between this Board of Health and the City Councils. Yes, but I've been here longer than you. But would very much appreciate more contact, particularly even some of the items that we'll come up with tonight. We have said we want to move to the City Council, and it doesn't necessarily have an easy pathway. So maybe you will become our glide path to the City Council. Thank you very much.
Madam Chair,
yes.
Please speak, please. I'd like to speak on behalf.
Okay.
Gary, I'd like to congratulate you. I think this is the third time you've been elected to Worcester City Council. Maybe the fourth, but
We'll come back, so we'll have it.
well, I wish you the best of luck and good luck in many more years on the council.
Thank you.
Yeah.
Yeah, I want to echo that. Congratulations on you returning to the City Council to election. And as you said, probably to keep working in public health issues and probably not too many battles between us and the City Council. Good luck and
Thank you, Leo.
Okay, I'd like to turn then to the minutes of the last meeting, which you have in front of you. And I'm looking for a motion to accept.
motion to accept the minutes.
Thank you, Leo. Is there a second?
Second.
Thank you, Mike. And we'll take the vote. Gary?
Gary Rosen, yes.
Michael Parado, yes.
Leo Negron Cruz, yes.
And Francis Anthes, yes. So the minutes have been approved.
Madam Chair, just a correction on the minutes. Parado is spelled P-E-R-O-T-T-O, no two R's, okay? Thank you, Madam Chair.
Sorry, we don't get dark. Now we've got it right on the letterhead, so that's at least one good thing.
That took a while too, but that's okay.
Okay. Because we have some people here for the public hearings, I'm going to ask the indulgence of the other members of the board that we change the agenda order in order to do the public hearings first. Do I have agreement on that? Yes. Okay. So then, Kyle, I think I would turn it over to you.
Thank you, Madam Chair. So we're here today to discuss two hearings for two separate violations at two different stores. I'll first start with Big W Smoke Shop at 345 Hamilton Street. So on October 9th, the Worcester Division of Public Health conducted a youth tobacco compliance check as part of the citywide tobacco enforcement program. During this, I directly observed a sale of a pack of Backwoods, one sweet aromatic cigar to a youth under the age of 21 at this location. The youth was able to purchase the tobacco product as the clerk did not ask for the minor's identification or age before proceeding with the sale. This sale constitutes a violation of MGL Chapter 270, Section B, which prohibits the sale of tobacco products to individuals under the age of 21. Retailers are required to verify the purchaser's age through valid government-issued photo ID. This business was notified of this violation in person and over the phone the following week and issued a $2,000 citation for this offense, consistent with the state penalty schedule for a second violation within a 36-month period. And just to touch upon what the first violation was, is that in January of 2024, there was a sale of a flavored product out of that store. A fine was issued and paid, and mandatory education was done. And then I list the exact wording from Mass General Law. A fine of $2,000 shall be imposed, and a prohibition of a sale of tobacco products may be imposed for at least 1 and up to 7 consecutive business days. The retailer was notified formally of the hearing on October 15th of this hearing right now, and the recommendation that we have for the Worcester Board of Health is to uphold the required sanction for a second violation and to issue a 7-day suspension of their tobacco license.
Thank you, Kyle. I have just one clarification. Under applicable regulations, I'm assuming it should read a second violation where it right now says third. Is that correct?
Yes, that's a typo.
Okay, so let's just correct that so we know we're talking to these gentlemen about a second violation.
I'm confused. What do he mean by the second violation? You said the violation was October 9th?
Yes.
And is there another violation of that?
There was a violation on January 2024 for a sale of a flavored product.
That's not correct. There is no, you said that was sell to the under minor?
It was a sale of a flavored tobacco product in January 9th, 2024.
That I don't remember about that, but we don't even, what kind of flavor product you sell?
I don't have that in front of me right now, but according to our records.
That's probably not accurate things because we don't, I don't, top of my head, I don't remember that part. So that's why I consider it as a first violation because this one. And also I talked to there is a new girl there and she don't remember anything. So I'm not trying to defend myself like, we didn't sell it. Maybe she did mistake, but I've been doing this business for 1997, many years. So I know the law actually. And my only reason I came here to just express my view that we have no intention to violate the law because that property I owned and we do little business about $200-300 sales a day and only I barely pay my mortgage, tax and insurance on that property and I do have all the record, the daily sales too. So the point was we are not on my intentions are not to sell or violate the law, but I don't know how she did it, or she says she don't remember anything. I talked to the girl, well then there is a girl that's on train, I think probably I already talked on the phone with him too. So, in the future reference, I will make sure that it doesn't happen again because, I'm really aware about the law. I've been doing many years this business, so.
And I actually do have the citation letter from that first violation if you'd like me to list the product that was sold.
I'm sorry?
So I have the violation letter and citation from that first violation in January of 2024. And the product that was sold was flavored tobacco, Grizzly Wintergreen vape product, Kratom tropical fruit, Puff LA vapes were sold over the counter.
That's not okay. This is the inspector. We had a. I can. That's one. Let me tell you what. We had a visited from the state department about is there a tax, and he called the inspector. There was a fine. There was a can of the Grizzly Wintergreen they found at the store, but we didn't sell it, but we gave it to the inspector, okay, and it was from either probably from the people who worked there, and also we just opened the store and we probably bought it from somebody, and probably previous people had it there, because we never sell Grizzly, we never order from it until now, we don't even sell it. But I explained to her, and when she gave it the ticket, I paid it. I didn't say, what, let it go. But again, we didn't sell it to anybody. That was the inspector. I handed to the inspector.
I wasn't the inspector who wrote that citation. That was Cherry, who was in before me, so I can't speak exactly to the details of it, but I only have to go on this letter and our records. So.
Right, I know what happened at that time. Sorry, I couldn't remember that. It was 24, yeah. So,
Okay, so I think we do have some agreement that the one in January of 2024 did happen, as well as the one in October of 2025. Is that accurate?
Yes, that did happen, but it's not same type of. We didn't sell.
Right, it's a different type of violation.
Different type of the violation.
Yes,
That's what I tried to mean.
Okay,
So, yeah.
I think we're clear on that. Any questions from members of the board? Leo? Mike? Gary?
Through the chair to Kyle. So, Kyle, just looking at the product that was sold here with this Big W Smoke Shop and the next potential violation, it was the same product, packed of Backwoods, one sweet aromatic cigar. So I'm assuming that's what is that something that we would always go in, the minor would go in and ask for?
Yeah, we asked them to ask for various products, tobacco and nicotine products. The results should be the same.
It could vary each time they go in, different store, different request.
It could. It just is the coincidence that.
It's coincidence.
Yeah.
Okay. And Cal, from your experience, which I know is extensive, we went in there into the Big W with the minor went in there on October 9th of this year. And evidently the clerk did not ask the minor, who obviously was underage, for his license. And I have to assume, and you know that better than I do, Kyle, I have to assume that we didn't catch their only one mistake that particular day. In other words, had we gone on a week or two earlier, had we gone on a week or two later, we probably would have found the same result. Do you find that through experience?
I'm not sure that we can assume that, Gary.
Oh, I'm asking just his opinion. I'm just asking his opinion. I can ask his opinion. He doesn't know, neither do I know.
It could all depend
he knows,
on...
But from his experience, is it possible that we caught the only one violation that year on October 9th? Is that likely?
I would also say
Likely.
I don't think you have to answer that, Kyle, if you're not sure of the answer.
Likely. I'll use the
Answer
word.
would be that I'm not sure. It all depends on the clerk. It depends on the day. I couldn't answer that.
Okay.
I would also say that it is a smoke shop, so a minor shouldn't even be allowed to walk around and browse products. They should have been asked for ID as soon as they entered and kicked out.
I would ask that you're the owner, sir?
Yes, sir.
I would ask, why would you not ask anyone who comes in? Do they have to, Kyle, ask anyone who comes in? If I went in, would I be asked for my license too?
They should. It's a 21 and over establishment, so they should ID everyone that walks in.
Okay, so everyone, even though they might be a senior citizen. It's still okay. So, sir, why wouldn't you ask? I mean, there couldn't be that much profit in a pack of Backwoods one sweet aromatic cigar. Couldn't be that much profit to take the risk.
Yeah. As I mentioned already, I've been doing this business since 1997. And I had so many stores, so many business around Massachusetts, okay, not only in this Worcester. Worcester, I had a store business on Lincoln Street too. So what I'm not trying to an excuse about that, but my point is absolutely I asked for ID. But the day he went there, probably that girl, she started training that day, and I trained her, my other student.
Did you train her to ask for the license?
Yes, absolutely, because, I trained her, but now I wasn't there. I don't know what happened, but I talked to her also about that when he called me about the violation. I was really surprised, I talked on the phone with him, really.
Is she still employed there?
No, she's not there. She was there a week after. She's not there right now. So now the said your answer. My answer to your question is absolutely not. We're not gonna. I'm not there. So I'm not gonna train someone to say sell to the minor. I was never gonna do that.
But doesn't that worry you that they might?
She made a mistake probably, and again she don't remember. I asked her. She said I don't remember. So
do you ask everyone for their license, their identification, every customer?
We do up to 30, absolutely. Up to 30, some people you can even, usually the law, I think law says, I don't know what is the new law or not, and I know that our law says you can ask up to 30 years old. That's what we thought.
Well, you wouldn't know who's 30 or 31.
Right,
or
but we ask for most of them. We ask ID anyway because we ask ID for most of the people,
Would you answer the same question that I did ask Kyle? Did we catch do you think, no, you don't know because you're not always there. Do you think that we caught the only violation in your store selling to a minor on October 9th? That was it for 2025. We happened to be there at that time, on that date, and that was the only violation.
That's the only violation, yes. That's what according to him, because I didn't get anything else. So, and as I said that, I always train my people a week before I send it to there myself, I do. So I'm not, again, I didn't know that what happened to this girl, or she was nervous or something like that, it's happened. But I always train them. That's what my point. Because because I'm not there, make sure is any issue with my license. I don't want to lose the license. I spent money to build that building. I bought the property for that. I only pay this mortgage and tax and insurance. That's all I pay for that business for now.
Kyle, would it make any sense to go in maybe even a week later? Can you do that? In other words, you have the evidence once, but just so questions like mine could be answered, you go in a week later and you find, there's a second violation. Now, 2 out of 2 seems to point to me, if it's 2 out of 2 violations, there's probably been many more.
Yes, I would say so. So I can also state that I sent a minor in a week before this sale took place, or a couple days before, to try to buy the product. The cash register wasn't working, so we had to go back another day. But it looks like the sale was going to proceed. And we went back a week later because the register wasn't working at that time, and then the sale occurred.
But we usually do just one visit, one violation, and that's it. We don't try a second to see if we could get 2 for 2? No?
No, because we like to have the violation, have the fine, have the penalty, and then give them a chance to, be educated on the topic, and hopefully it doesn't happen again. But we do routine inspections for youth compliance checks as well as the state. So those happen around
and the fine is $2,000 for this?
For a second violation,
For the second violation. Do you know if that's been paid?
I do not know. We give them 21 days to pay it. I would have to check our records. I'm not sure if they're within that 21-day window.
Okay. Okay. Thank you, Madam Chair.
Thank you. So we have a recommendation coming in front of us from Kyle and the staff of basically the second violation being the $2,000 fine and the 7-day suspension of the tobacco sales. Is there anyone who would like to put that in the form of a motion, or does anyone have other comments to make?
Yeah, my motion is to accept the recommendation for the Division of Public Health of the $2,000 fine and 7-day suspension.
Thank you, Leo. Is there a second?
Second.
Thank you, Mike. Okay, I'm going to ask for everyone to vote on that. Gary?
Gary Rosen, yes.
Mike?
Mike Parado, yes.
Leo?
Leo Negron Cruz, yes.
And Francis Anthony's yes. So this will be the penalty. The staff will be getting in touch with you. What I would really encourage you is, so now there's 2. The third one is much worse. And so I hope that the staff also educates you how each time there's a violation, the punishment gets worse, so that you can really work hard to avoid the third one.
Yeah, I understand that, but again, I'm not considered this number two. This one sell to minor this is the first time this is the first I'm considered that.
Yeah. But a third violation of any of the regulations would put you in a different category with
yeah.
violation number 3.
Okay, yeah.
So I just kind of advise you on that, okay?
Okay, thank you.
Thank you.
I'm all set, right?
You are all set. Thank you very much.
Thank you so much. Thank you.
Okay, Kyle?
Okay. So the next violation hearing is for Family Mini Mart at 241 Lincoln Street. On October 28th, the Worcester Division of Public Health conducted a youth tobacco compliance check as part of the citywide tobacco enforcement program. During this operation, I directly observed a sale of a pack of Backwoods One Sweet aromatic cigar to a youth under the age of 21 at this location. The youth was able to purchase the tobacco product as the clerk did not ask for the minor's identification or age before proceeding with the sale. The sale constitutes a violation of Mass General Law, Chapter 270, Section 6, which prohibits the sale of tobacco products to individuals under the age of 21. Retailers are required to verify the purchaser's age through valid government-issued photo ID. The business was notified of this violation over the phone during the same week and issued a $2,000 citation for this offense, consistent with the state penalty for scheduled for a second violation within a 36-month period. The first violation occurred in June of 2023, where they had a sale to a minor. A fine was issued of $1,000, which was paid, and mandatory education was given. And then again, I have the general law stated right below in applicable regulations that says that a fine of $2,000 shall be issued, and the tobacco product prohibition of the sale of tobacco products may be imposed for at least one business day up to 7 consecutive business days. The retailer is notified of the hearing on November 3rd with this letter for this hearing tonight. In accordance to the law, Worcester DPH recommends the Worcester Board of Health uphold the required sanction for a second violation by issuing the 7-day suspension of the tobacco permit.
Would you like the opportunity to address the board?
Yes, hello everyone. This is the first time, so we had a first violation. This is a small business. I'm open myself as a student since 2010. Happened to be violation happened when this sense is run by family members only, because I work and my brother works. So my brother left for back home for his mother to see her, and I had to have somebody there working. And I checked the surveillance camera system as well. So sadly, the person who was working there, because we were covering, I was there, we were doing shelving. We had a delivery at that day. He scanned it, and I think he did not realize when he was trying to sell it. We ID every single person. I even, last time when it happened in 23, I make it, if any violation happen, whoever sells it will be paying that fine, because I make sure everybody get training. And our POS system, whenever you scan any tobacco product, it required, it populated, hey, check ID. So since that person was new, so I don't know how he did it, but that happened. And at this time, also I work there myself all day long as well. So this morning happened, some kid walk in and ask for the paper, and we ID him, and he happened to walk out. And I'm pretty sure the city always check multiple times, go around the year, we always ID it. So this happened because of the person was not, we did train him and everything, and that's why I was working myself as well. When I check in a video, that mistake happened. I'm not going to deny that, and it is wrong to do so, and I always follow the regulations. We didn't have any issue with it, but happened to be just because of the person regularly working there left for back home. He's still not here. I'm working myself. So we already trained that person to the person is working, and I actually make in a POS. We are doing software updates so that way they are not able to sell tobacco without scanning the ID. So whenever you scan any barcode which is relative to tobacco product, so they have to ask, otherwise the POS will not show the pricing, will not let them make a sale. So this is a small convenience store. It's a food place. Like other smoke shop, I cannot stop kids to coming in. But what I can do is to make more restrictions, and which can we can continue training ourselves. So hopefully this kind of things never happen again.
Thank you. Questions from the board? Leo?
No questions.
Mike?
No questions.
Gary?
Through the chair to Kyle. Kyle, in the pack of Backwoods, one sweet aromatic cigar, that to me sounds like flavored tobacco. Is that flavored tobacco?
No, it's not flavored.
Oh, it's not, okay. Which would have been another violation if it were?
It would have been consistent with the second state violation because both of those laws fall under the state law.
Right, and this is not a smoke shop, it's a mini mart.
Correct, it's a general convenience store.
I see. Okay, and when the miner goes in, does that miner carry any ID?
No, they only have their cell phone to communicate with me and the money that I give them.
So if they're asked for the ID, which sometimes I'm sure happens, hopefully happens all the time.
Majority of the time, yes.
Majority of the time, sure. So they just say, I don't have an ID, and that's the end of the possible transaction. That's the way it usually ends, right?
Usually, yes.
They say I can't sell it to you. Is there such a thing? Does anyone have this? Maybe it would be an expense. Maybe it doesn't exist. It would seem to me if I was going to open one of these shops and sell tobacco, I would have something where the sale couldn't be completed by the clerk without taking some ID and putting it into some slot in the machine that would...
That's what he just suggested to us he's going to do.
Yeah, but he's going to do it. So we have those machines is what I'm asking, Kyle?
Yes, most of the stores that are corporations like the Shells, Cumberland Farms, they have all those machines. They're just expensive, so some of the smaller stores don't have them. So
but Cumberland Farms, so the sale couldn't be made unless the ID was put in that machine?
AID, any ID, yes. An ID needs to be entered for those kinds of machines.
Okay.
Doesn't necessarily need to be a specific ID.
Okay. All right, thank you, Madam Chair.
Okay, thank you. Okay, the recommendation for a second violation is the $2,000 fine, which has already been issued, and then it would be 7-day suspension of the tobacco sales permit. Is there a motion on that?
The motion is to accept the Board of, the Department of Health's recommendation, Madam Chair.
Thank you, Michael. Is there a second?
I second that.
Thank you, Leo. Okay, we'll take the vote now. Gary?
Gary Rosen, yes.
Michael Parado, yes.
Leo Negron Cruz, yes.
Francis Anthony's yes. So this means that you are going to get the fine. You are going to also have your license suspended. The staff will be in touch with you about that. But we really encourage you, as your colleague,
doing our best.
basically, you don't want the third one.
We definitely don't.
Okay.
We definitely don't want to do that. Anyway, thank you so much for everyone for your time and listening to us.
Thank you.
Thanks so much.
Okay, I'm going to turn us back to kind of the agenda. And I think, Amelia, that means that we're looking for a communicable disease update from you. We do have in front of us your written report, so I encourage you to tell us anything we need to supplement this.
Hi. To the chair, to the board. This is Amelia. There, you have it all in front of you. Basically, there are no significant changes except with the COVID cases. Those actually went down in October from September, from 187 to 57. Influenza is still pretty stable and low. There was no measles, no malaria. Salmonella, there was 1 case each month. And we had a new entry. We had a case of Mpox in the last month. So I just wanted to say a few things about Mpox, and I'm not going to read the 3 paragraphs here, just to let you know that in 2025, Mpox continues to pose a low-level public health concern in the United States. The CDC reports ongoing circulation of the clade 2 mpox, because if you remember, there are two clades, clade 1 and clade 2, across multiple communities. And this is consistent with patterns established during the 2022 global outbreaks. It still remains significantly reduced compared to peak levels, and overall, the risk to the general population is low. The CDC does continue to implement comprehensive prevention strategies, and they also include wastewater surveillance with their detection systems. So early identification and rapid response to these emerging cases. And we remain alert and engaged in monitoring. So that's it on mpox. And that was just the disease that I wanted to highlight because we had one case of it last month. So now I think, and Dr. Hirsch can add to this report by highlighting some of the other things that he's come across.
Thank you, Amelia.
Thank you.
I just have one question. Was our one case also travel associated?
Yes.
Okay, thank you. Any questions from other board members? Gary?
Amelia, do you have any concerns about 9 malaria cases in October with 0 in September? That seems like a pretty big increase. I know your report said below, no malaria cases, but in the chart, the table, there are 9. So I don't know which it is, but going from 0 to 9 in 1 month would seem to me maybe that's concerning.
It is concerning. Let me double check on that number. There might be a mistake. I don't think we've had 9 travel malaria cases in 1 month, but I will double check on that and send you all the correction.
Okay, thank you, Amelia. Thank
Mike?
you, Madam Chair.
Mike, any questions?
All set, Madam Chair.
Leo? Okay. Thank you very much, Amelia. We appreciate this report as always. You keep us on our toes. Dr. Hirsch.
Hello. Thank you for indulging me attending remotely. I have a cold, but I tested negative for COVID, but I didn't want to take a chance of exposing anybody else to my cold. So I think that there are 4 things that I would mention to augment Amelia's excellent report. One is that in the Pacific Northwest, we had our first case of a different type of bird flu called H5N5. Previous cases of bird flu, which we haven't really had in 2025. We had 70 cases of H5N1 during 2024. But in 2025, we haven't had any. But this is the first human case of H5N5, which is a variant of the bird flu. It occurred in a owner of a poultry farm where the poultry was, quote unquote, I guess, called free range. So they wandered about a field in which migrating waterfowl landed, and that's how the transmission was presumably occurring. Unfortunately, in the bird land of bird flu, when that happens, you have to pretty much sacrifice the entire flock as the only mitigating factor. So it's kind of a warning about if you do have domestic chickens in your backyard or a poultry farm, that you really have to be careful that they are not intermingling with waterfowl. The waterfowl right now are migrating south, and probably as many as 80% of them are infected with bird flu. The human patient with bird flu H5N5 out in Seattle is not severely afflicted. I think he spent 2 days in the hospital, some mild respiratory symptoms, the typical kind of flu-like symptoms, and he's doing well with just symptomatic treatment for his headache and achiness. But it's an illustration of how this bird flu is mutating. And sooner or later, the expectation amongst the veterinary population and also amongst virologists here in the United States is that it's going to figure out a way to infect humans more vigorously, that you wouldn't necessarily have to be raising birds to catch bird flu. I spoke again to Jonathan Runstadler, who's the head of infectious disease at Tufts Veterinary School. He said the level of concern about bird flu is steady. It hasn't gone to, a DEFCON 1 kind of situation. It's still moderate concern, but definitely if you are around poultry, if you're around livestock, if you're around migratory birds, hunting out in the woods, you really have to be careful about your exposure. And if you did have respiratory symptoms, flu-like symptoms after those kind of exposures, you should come in and get tested for the bird flu. We're still in the early stages of understanding what this all means, but it still may be the early stages of what might be a bigger outbreak situation, but so far not so. As Amelia mentioned, the COVID numbers have gone down considerably in October. The first week in November, interestingly, they went up again a little bit. They were about at a level of about 500 cases in Massachusetts a week. In the first week of November, they went up to 625. So we don't know yet if that's a trend or not. As you might imagine, with the cold weather, more and more people are going indoors, and we'll see if that ends up being something that we need to be concerned about. We're still recommending, as you all know, that people in the highest risk groups get their COVID vaccination done. We also feel that the misinformation about pregnant women taking the vaccine or children over the age of 6 months taking the vaccine are unfounded, and they should get it if you want it. And best thing to do is talk to your primary care doc, because the American Academy of Pediatrics, the American Medical Association, the American Academy of Obstetricians have all come out with white papers indicating the safety of the mRNA vaccinations involved with COVID. Today, however, one patient contracted a case of COVID that was interesting in that it was a pregnant patient, and Mass General Brigham released a study today that said that the incidence of neurodevelopmental problems in babies whose mothers contracted COVID in the first trimester of their pregnancy was higher than expected. Still very rare, but higher than expected. So I think it is very important, if you are pregnant and you have flu-like symptoms, to get yourself tested. And if positive, you should be monitoring this carefully with your obstetrician and pediatrician. But also, if you are concerned, get yourself vaccinated in the early stages of pregnancy. it will reduce the likelihood of these kind of complications. The other disease that has fascinated Dr. Runstadler and public health officials around the Northeast is that a New Jersey man who apparently was hunting and bagged a deer that he ate the venison meat of, contracted a tick bite by what has been called the Lone Star tick. It's a different kind of tick than we have seen in this region, and it has migrated, as you might imagine, from Texas. It can cause what's called alpha-gal disease, which makes you allergic to red meat. After eating this venison and getting this tick bite, the hunter subsequently, 2 weeks after the venison had made him sick, just with some nausea and vomiting, had a hamburger, and he went into anaphylaxis and died. It's a young man, 38 years old. We don't know how much of the Lone Star tick has made it up to Massachusetts. There have been reported cases of alpha-gal in Connecticut, and we're going to be monitoring this very carefully. But it goes back again to things that Amelia and I have talked to you about doing tick checks. If you're out in the woods, if you're an outdoor person, if you like to hike, if you like to hunt, if you like to just be out enjoying the outdoors, you should still be doing tick checks. We really haven't had the hard frost yet, although it's getting cold. That will kill the ticks at least till the spring. So you still have to look out for tick bites. And some of these tick bites might be from the Lone Star tick. And if that occurs, you don't know about what it'll do to your immune system about red meat, but we're going to get smarter about this, I think, now that it has really come to the point where somebody has died from alpha-gal. And we'll have to kind of see where that all goes. Dr. Runstadler said so far in the Northeast, he felt pretty confident that it wasn't widely prevalent, the Lone Star tick, but New Jersey isn't that far away, really, in the scheme of things. And then the last thing I'll mention is that it was interesting that yesterday on one of the morning Sunday talk shows, Secretary Bessent, the Treasury Secretary, mentioned the screwworm problem that I had mentioned a few times already in our Board of Health meetings as a reason that beef prices are going up, because they're trying to keep beef from the South America and Latin America from coming up north. I asked Dr. Runstadler about that. He is only concerned that the Department of Agriculture, again, has lost a lot of staffing, and he's worried that the vigilance about this is not as strict as it might be. And now with the new deal that was negotiated by President Trump about getting Argentinian beef here at a more reduced rate, he's concerned that we might be seeing some of these infected beef products coming up here. Screwworm, if you remember, is a larvae of the bot fly. The bot fly invades the skin of cattle, lays an egg, the larvae of which is able, once ingested, to boring its way through your intestine and causing havoc that way. So these are bizarre worries to have, and I wish we didn't have it. I think a lot of it is related to climate change, which we have discussed here, and unfortunately I don't see us doing a lot of mitigations about that, but it's something that I think we're going to have to be vigilant for moving forward. I think in 5 years, you might be hearing more about those kind of bizarro infections than we ever had before. That's my report.
Thank you, Dr. Hirsch. It seems like there's a perfect storm aspect of this, though. Not only is the environment meaning that we might be getting kinds of insects or ticks or that we haven't seen before, but we also, as we cut the inspection services in the Department of Agriculture or wherever, we may be more vulnerable. So it seems like it's more than one factor.
Absolutely.
Any questions or comments? Gary?
Thank you, Madam Chair. Dr. Hirsch, one question. As you talked about bird flu, and as that changes and mutates, and with other things you added to that, is it possible that we might be getting closer to see bird flu being transmitted from human to human?
That's a great question, Mr. Rosen, and I would say through the chair that that is the greatest worry that the virologists on the human pathology side and the veterinary side are worried about. So far, there's demonstration that the bird flu can mutate, but so far it's only been animal to human transmission. We haven't seen a human to human transmission that we're aware of. And I do think that it's inevitable that that's going to happen.
Okay, thank you, Doctor. Thank you, Madam Chair.
Mike, any questions?
Yes. Thank you, Madam Chair. Dr. Hirsch, I find it quite concerning about this meat situation coming from Argentina.
This might be happening when the meat will be coming in? And do we have any type of regulations with the grocery stores on identifying where the meat is coming from?
Well, the USDA is the one that really determines, what might be an illegal source of beef. And right now, they are issuing warnings to large, supermarket chains and grocery chains not to accept beef from South America, except from Argentina. So they are trying to set out that alarm. But I think that there is a black market for this kind of meat. And what Secretary Bessent was saying yesterday is that meat from south of the border is making its way into the United States. I know that we supposedly have closed down the border to human migration to a great degree in the last 9 months, but apparently cattle is making its way north, whether it's in big rig trucks with frozen meat or whether it's in actual cattle that are being driven across the Rio Grande a la rawhide. I don't know, but it's something that we're going to definitely have to monitor more carefully, I think, is where your beef is sourced. It also is true that it's not just in beef. It is in meat like that's not regulated, like venison or, wild boar, those kind of things. If you're a hunter, you can't assume that this meat that you've killed is safe to eat. So that's something I think we're going to have to do a little better job of public information about, because this may not be the best season to be enjoying those kind of game kills.
Thank you, Dr. Hirsch. Maybe I'll consider becoming a vegetarian. Thank you for the information.
Before or after Thanksgiving? Next question, Leo. Okay, thank you very much. Dr. Hirsch, thank you. We appreciate you keeping us up at night about what else we can worry about.
Thank you, Madam Chair.
Right. Right, sorry. Debbie Downer.
Okay. Emma and Devin, I think you're going to report to us next on kind of a follow-up from where we began last week.
Yes,
month,
Madam
sorry.
Chair, I just need to share something
Sure.
to the screen.
Sure. Sorry, all three of you. I didn't mean to neglect you, Nicholas. I don't know whether this is one report or two.
All right, so good evening to the board, to the chair. This evening, we're going to present the Environmental Health Dashboard. This dashboard was developed in collaboration with the EPI team, and we created this dashboard to provide a clear, accessible visual representation so the board could get a clearer interpretation of the data received from ISD Health and Housing Department. And I will just scan through a little bit. So this is just the first page of the dashboard.
And you may recognize that the Board of Health is not particularly educated up until this point on all the different aspects of the department, so we're still learning. So excuse at least my ignorance, but there may be places where we're going to ask you questions that sound like we should know it and we don't yet.
And this is just an overview of everything. So this is so we'll go to the data. The data that we've collected in collaboration with Health and Housing is, the way we've collected it is based on state and city standards to meet the strategic plans and also to meet FAB measures as well. The purpose of the dashboard is to utilize the data to track and compare important metrics. And at this point, we chose to track permits that were provided for the year and permits that were provided for the fiscal year 2026 quarter one. And this is just some examples from the air and water team. This would be I'm sorry, this is in the way. The bathing beach permits. It's usually 5 total for the year for all bathing beaches in Worcester. Then they have the controlled radiation tanning facilities. There are 7 total in the city of Worcester, and that's just your tanning salons. Hazardous materials permits.
So if I could just ask a question.
Sure.
It looks like, and again, I'm trying to just figure out the graph.
Okay.
So it looks like the tanning facilities is the red line the last year and then the blue line this year? Because we can't see that far
I
away.
apologize. So the blue line is for current year 2025.
Okay.
The red line is for the fiscal year 2026 quarter one.
Okay, great. Thank you.
Hazardous materials, those were 5 permits. So there were 5 permits for the current year. So there's 5 permits distributed for the current year, total current year. For this quarter, for the fiscal year 2026 quarter, there were 3 permits issued. There are also ice rink permits. There were none issued. We also have the rDNA labs, and those were just issued for the year. There were 12 of those. And we also have the public, semi-public swimming pools. For the current year, 2025, there were 16 total, and for the fiscal year 2026, there were 5. And that could be hotels. During the summer, there are more permits issued from that department. Recreational camps, there were 20 permits issued for the year and 2 permits issued for the fiscal year. And this is just, we can go on, but this is just an example of the how we're utilizing the data to kind of look at the amount of permits that were issued throughout the year compared to the amount of issues that were issued during the fiscal quarter, during the quarters.
For me, one of the most interesting parts about this, again, as I say, we're new for monitoring this at all, is just even understanding how many recreational camps for kids, how many tanning facilities, how many hotel pools. So the kind of getting the scope of what you're doing is very helpful.
And this comparison is it helps us better understand the scope and the reach of ISD's permitting activities, and it helps us identify gaps and trends over time. And the coming soon is, at this moment, we are still working on building out the dashboard. So there's going to be more data added for the Air and Water Division. And that would include complaints, air pollution, asbestos. Those could be complaints, sewer and sanitary overflow. And these are all followed by the state sanitary code. And for body art, it would be the same information, but the one division we chose to highlight based on the data was the food division. And we chose the food division because the food division is interesting because they issue permits throughout the year. They issue seasonal permits, temporary permits. So it's year round. Let's see. I'm sorry. Apologize. And if we look at the graph, so right here we have, and this is historical data that we collected from the division, 970 permits were issued throughout the year based on our data. 210 permits were issued during the fiscal year, quarter 1.
And does a food permit include both a restaurant that operates every day and, a local event, a barbecue or something like that? Are they both in this kind of thing?
Well, no, this would just be for your food establishments, schools, churches, any establishment that uses.
Hospitals?
Yes. Yes.
Okay. Nursing homes, yeah.
Yes, year round. And the data and this data here, right, would be the food inspections. So the number, throughout, I think, so for October, there were 103 food inspections, routine food inspections. But as you see at the bottom, the blue would be food establishments, the red would be mobile food vendors, the orange would be temporary food events, and then there's seasonal concessions, so seasonal events.
Okay.
And this graph shows the routine inspections conducted. So for the year, there's about 2,000 inspections done per year. And this is just the first version of the dashboard right now. It's still in refinement and development, and it's still growing. And as we work in collaboration with ISD to streamline data gathering processes, then we'll continue to build out the dashboard to add all ISD departments and include more activities such as inspections, complaints, and everything else in order to track metrics and also trends. And with that, we'd like to hand it over to the ISD Commissioner, who can provide further insight with all things ISD.
Okay, thank you.
Good evening, Board. My name is Nick Antanovica. I'm the Commissioner for ISD. I started back in May, so I'm still getting up to speed with the department at the moment. It's been about 6 months. What we're looking at here, though, is we're trying to bring some change into the department from where we've had it. One of the big changes that we're bringing in is fully implementing the OpenGov permitting system. So this is going to help us establish these dashboards and then also give us some good data in order to inform how we're going to be changing the way we do inspections throughout the city. We have several different initiatives that we're going to be working on over the year. First one is department trainings. Working on getting all of the different aspects of the health side of ISD trained up so that we are able to go out and perform the different inspections that we are required to do properly and consistently. And also providing education while we're out there doing it too. Our codes change all the time in different ways. So we want to make sure that the people that are required to follow them and that we're out enforcing them are educated properly so that they're able to keep up with that. One of the other items that we're working on continuing to implement and streamline is our rental registry program. While we're doing this, this helps inform several other items that we're going to be working on. That's working with the complaints to help build out our dashboard, to figure out what our highest complaints are in the city, where they are, if there are trends for certain areas, if there are trends for certain landlords, if there are trends for certain rental types, so that we're able to go in there and effectively change how people are working throughout here and increase the safety and livability of the housing stock within the city of Worcester. As I said, we're working on building out the permitting systems in OpenGov. We're also looking to change our complaint systems as well. We're looking to streamline our complaints to help inform ourselves on how we do our educational programs throughout the city, our training for our inspectors, and then also update our ordinance and other systems that we're using to do this enforcement. So what we're looking to do and hope to do that is have some consistent categorization of the complaints that are coming in so that we're able to effectively move through, resolve the complaints, but then also educate the community so that we can reduce the amount of complaints that are coming in. That could be whether we're looking at the trash or we're looking at no heats. Certain areas that we have bed bugs. Bed bug education is a big one that we would like to get out there as well. When we also look at it too, other initiatives that we're coming into with our new OpenGov system is, I believe the board just passed the body art regulations last meeting. So now that we have those in place, We'll be moving forward with updating that application because the new body art regulations that came in have the requirements for the trainees. So now we have now we're able to implement those and have those working in there for any of the new practitioners that are learning. One of the items that Devon brought up when we were showing up there were the food inspections and licensing. Over the next year, we are going to be modifying how we issue food licenses. Right now, we do it by size of location. We are going to be switching over to a risk-based license system. We'll do a further presentation on what that means by switching over to a risk-based system. But the short version of it is that by switching to this, we will improve the effectiveness by which we can, gain compliance by the restaurants. By having a risk-based system, we inspect those that have more challenges or more difficult cooking systems more, and the ones that, like a 7-Eleven, that don't have as delicate or intricate working systems such as maybe sushi, only get inspected once. But also having the risk base is that we can also take into consideration actions of the establishment. So if we get a significant amount of complaints, they may get moved up to a risk level or moved down. So more to come on that as we start rolling that out over the next year. One of the other items that we're working on right now, it's winding down a little bit, but we're getting ready for a big media promotion in the spring, is revamping our rodent control program. So we're coming in, we're taking a look at the different ways that we're promoting education for rodent control. We're also looking at the technology that we're using in order to inform our enforcement for the areas. So we're looking at gaining new technology with the different types of traps that we have in order to have the Bluetooth traps to identify high traffic areas and then inform our treatments and enforcements depending on the data that we're getting back for rodent traffic and locations. Another item that we've seen has been a big area on the health side has been the amount of sober houses that have been coming in through the city. One of the areas that we want to focus on is establishing a sober house ordinance so that we have two aspects that we can do in there. One is the physical safety of the people in the environment that they're in, making the buildings themselves safe, making sure that they meet the requirements of the building and fire codes. But then the second aspect is to make sure that when people are coming in and entering a sober house as it's being advertised, that they are actually getting the treatments of being in a sober house. Because right now we have a lot of people, from what we can tell in the city, calling themselves sober houses that are just taking people's money and they're not providing any services. So part of doing this ordinance is to establish what a sober house requirement is and to make sure that when they are being advertised as such, they are providing those types of services as
And
well.
that's a national issue, as I understand it, right?
Yes. And then lastly, one of the other initiatives that we're looking to help promote is and implement is equitable code enforcement. The way that we look at this is that we want to make sure that everybody is being treated fairly, but that when we are doing it, that we're making sure that people are understanding the reasons for the enforcement and that the education is there. One of the biggest things for the equitable code enforcement that we started is the rental registry program, and that is because by having the rental registry program, we can be proactive on finding a lot of the deficiencies within the rental units and not having to rely on the tenants of those units to report them for fear of losing their lease or being evicted. So again, the rental registry is an example of the equitable code enforcement that we're going to be looking to implement throughout the city, in the future. And then just one last item to talk to you, just to see ISD by the numbers. I know Devon just gave you a few of them, but for on average, we have just under 1,000 food and drink licenses that we issue each year. We do just over 500 one day. Those are the temporary licenses, like the barbecues and the alcohol permits. Average 58 mobile licenses, 28 farmers markets, 48 body art establishments, 113 tattoo artists. We get over 12,000 complaints a year and have just over 30,000 rental units that we are trying to inspect on a 5-year basis. So that's just a little bit of what we do, and hopefully over the next several meetings, we'll be able to help you learn a little bit more.
Thank you. This is really good information for us. I mean, I've been on the Board of Health for quite a while now, and I would only be guessing at those numbers without your presentation tonight. So I really appreciate it. Thank you very much. Leo, any questions? Mike.
Thank you, Madam Chair. Madam Chair, in the future, I wonder if we could, and I'm going to make this phone motion. I love the presentation, but the lighting in here is very difficult, okay? If we could maybe get an email sent to us where we could print it out, or if you, when you're providing these presentations, if you could provide it with paper. I know paper is old, okay, but it's really sort of difficult to see the screen. I do appreciate your commentary. It was excellent. I agree with the chair. Information.
Through the chair, that was my fault. I emailed this to Brenda about 2 hours before the meeting. That's why you don't have a copy.
Okay. Well, in the
I'll
future.
make sure I'll get it in earlier.
Well, I will say through the chair, you have a full plate. And my question to you is, okay, there's a lot that you told us tonight. What are the top 3 priorities of your department right now? With everything you told us.
Right now, it's rental registry, rodents, and updating actually, it was the body art, but with the body art being passed, now we can start that. So now it's starting the transfer of the...
Thank you very much, Madam Chair. Appreciate that. Good report, guys. Appreciate it.
Gary.
So what size is the ISD staff? Is it a big staff?
The entire department is 75 positions.
Oh, that many, okay. And I know you oversee permitting, and you mentioned a lot of good things. I know maybe within the last 2 years, the Worcester City Council considered those health clinics that are against abortion, and there was a lot of concern that many women who went there were being misled by those clinics, and they might have wanted to go for abortion services, and they thought that's what they were talking about, and it turned out that maybe some of the advertising by those clinics was very misleading, and they had other ideas once the pregnant women came in. And I know the city council, I think they kind of arrived at the point, there's nothing we can do about that. That wouldn't be something in your department that if you felt the clinic was advertising erroneously and maybe lying in their advertising, that wouldn't be good for the people in the city of Worcester, the women who will come there for services and are pregnant. Is that something that your department wouldn't be looking at?
Through the chair, without having a specific ordinance that prevents that type of business, there isn't anything that inspectional services would be able to enforce without that. Looking at this from what we currently have in place, it would either be through zoning or in advertising where ISD would be able to help, and currently there isn't anything on the books that would prevent an establishment such as that.
So false advertising isn't something that you come across frequently and you'd be able to do something about it?
False advertising is not an item that falls underneath ISD. ISD permits signage, but we don't necessarily permit what goes on the signage unless it's vulgar.
I see. Okay. Thank you very much. Thank you, Madam Chair.
Okay. Thank you very much for this presentation. It's really very, very helpful, as I think my questions even indicated earlier, but it's really kind of nice to know kind of who's doing what in the department and what the quantity and as well as the quality is. So thank you very much. We look forward to continuing to learn more about what you're doing.
Thank you, Madam Chair.
Thank you. I think then we're up to the director's report. Tamara?
Thank you, Madam Chair. Everyone should have the report in their packet. I'll just highlight that for the month of October and for the month of September, for motions recap, we did not have any major motions requiring follow-ups. So I will just, if you could turn to your pages in August for motion recaps for the Board of Health meeting. You'll all recall that there was a motion requesting that WDPH look into the issues of whether there should be a delineation of regulations between smoking bars and retail establishments. I just want to say that that is still underway. And as updates come forward, we will share those. An update we want to provide to the Board of Health on a motion also made in the month of August regarding the WIDE initiative. So we had sent out the letter that the board approved, signed off on during one of our previous Board of Health meetings. And we have since then received a verbal and formal agreement from St. Vincent's Hospital to join the WIDE initiative. This is where we're collecting data from the various health systems to be able to create local and real-time data dashboards that will help support some of the data dashboards you see here within the Division of Public Health and help us to have a good sense of overall public health in the city in a more real-time fashion. We also received a formal agreement, and Family Health Center has come on board and has started participating in that effort alongside UMass Memorial Health in the city of Worcester and DPH. So those.
And UMass Memorial isn't on the list because they were the place where they
were
started?
Exactly.
Okay.
We already have that data.
Okay.
And so, you know, working to bring more people to the table, but I do think the letter that the board signed, I like to think that it had some, encouragement and contribution to movement on that front. So thank you for your help. We continue to work with Edward M. Kennedy and Reliant and working to push that overall community effort forward. For the month of June, again, just wanting to make sure that we recap and let the board know where we stand on each of the motions that were provided before. In requesting that we look at the city departments in Worcester Public Schools collaborate with community partners to develop a system that supports Worcester's immigrant population in knowing their rights and pursuing protected status to remain in the country. We've had a number of internal conversations and discussions around this, and including with the board chair. And we are in the stages of sort of working with DEI to see if ORI will present to the Board of Health a training that's not recorded but open to the public. And reason being is ORI wants to avoid the perception of giving legal advice in a public forum and really pushing for individuals to get consult their own attorneys. And so that would be the reason for not having that recorded. And so that is a bit of a change from the last time we discussed this matter. So I wanted to just bring that before the board and see if you will all be in agreement with that.
Yeah, we had actually asked about having that presentation as soon as this meeting, but because of the request of ORI, which is the Office of Refugees and Immigration, we, I think, are interested in the information, but it would be a different kind of meeting in that we would not be recording it. So we just wanted to run that past and that's for legal issues. Yeah, that's okay. Yeah. We just wanted to run that past members of the board, and if you're okay with that model, then Tamara could get it set up.
Madam Chair, would that violate the open meeting law by not recording?
I think the meeting would be open. It would be a
Okay.
public meeting that would be open, but we would not be recording it.
And through the chair to Tamara, why don't they want it recorded? Any specific reason?
So, through the chair,
Yeah.
the response that we've received from ORI is that they won't want the recording to be perceived as legal consultation
Okay.
being provided to the community.
Thank you very much.
You're
Appreciate that clarification.
You're welcome.
Thank you, Madam Chair.
if everyone is in agreement, then we will work with the EI to set up that type of meeting with the
Right,
board.
so the motion recap, the recap of previous board meetings, which came into the June piece, is basically us asking, this board asked for that kind of an update. And what we're now saying is, yes, but we would have it be a publicly advertised meeting, but we would not be recording it. Right?
Correct.
And I'm not sure, you could get, would we allow it to be a virtual meeting? Or would we just have it in the room?
My understanding that it would just be in the room through the chair. So a training for those who would like to participate.
And so we might, instead of putting that on the agenda for one of our regularly scheduled meetings, have it be a training as opposed to a regularly scheduled meeting, which would take care of the open meeting law issue for you.
I like that motion.
I do
Do
too.
you need a motion on that? Or
Why
do we
not?
already have enough?
I think as long as we agree to this sort of
Any
amendment to the
disagreement
motion.
among board members that we could do it that way?
Fine.
Gary, you're okay? Mike?
Good.
Okay, yes. Go for it. Thank you, Tamara.
Thank you. Okay, I'll move on to the next item. So this is a recap of a previous motion as well for the month of June. Just circling back for requesting of Staff Division Public Health to look into the ILRC, so the Immigrant Legal Resource Center information. In further internal conversations with administration, the guidance provided on this motion is that WDPH is to provide a supplementary report that would highlight the existing work and services already being offered to address the concerns and to share that information with the Board of Health for its consideration and potential dissemination. Are there any questions about that? Okay, we'll move on. As just a standing update, we continue to wait on feedback regarding the primary care for you legislation letter of support that was submitted, and as updates on that status are made available, that will be shared with the board.
I think there's some questions on that, and also, Gary, here's one you can carry right over to your new role.
It's going to be your first order.
And Mike, what were your questions?
That's exactly where I was going with it, Madam Chair.
Okay.
We have a newly elected city council. I think this is very, very important, okay? And I understand, this has been out there a while, and I do appreciate and respect the council being able to vote on this. So I'll leave it up to Board Member Rosen, when he becomes City Council Rosen again, to make an order so that we can pass this and get this letter out. Thank you, Madam Chair.
Thank you. And I think that we saw from you, Dr. Hirsch, that the Boston Public Health Group has approved it. And I think we also saw that this is continuing to move. So I wondered if we had missed the boat, or if this is actually continuing to move. And it seems to me something you forwarded, Dr. Hirsch, said that people do expect this to be taken up in the spring part of the legislative agenda. Is that correct?
Yes, Madam Chair. Dr. Altman was very optimistic that it was going to be passed this next legislative semester.
So, Councilor Rosen, you've got a timeline even.
We'll be watching.
Haven't been sworn in yet. The drafted letter is under review. It says, can I get a copy of the letter?
Yes, we can through the chair send a copy of the letter.
Thank you.
Uh-huh.
Thank you, Madam Chair.
Thank you.
Okay, moving on to the next, just a few updates. There's a lot of great things happening in the division, but we wanted to share with the board that we did successfully have our FAP site visit that finally occurred. It was 2 days, full days, with the Public Health Accreditation Board. We had 3 reviewers, and the team did an excellent job. Overall, we got really great feedback on our strengths and opportunities for improvement. Some of our strengths actually being a lot of the support that we get from the board and the clear connection between the Board of Health and the Division of Public Health. So that was actually a strength highlighted during our recap session with the reviewers. We also received feedback that the passion and commitment that our team displays in the work that we do every day is evident and known. And so I wanted to just take my virtual hat off to all of our staff in DPH as well. Madam Chair.
And maybe we could put that in the form of a motion to thank staff for their work and successful completion of that site visit. So I would be looking for a motion on that. Maybe not.
I'll, in a form of a motion, we'd like to thank the staff, okay? And you can, for all the hard work that they've done on this particular issue. Thank you, Madam Chair.
Thank you, Mike. Is there a second for that?
We'll second that, Madam Chair.
Thank you, Gary. All in favor? Gary?
Gary Rosen, yes.
Mike?
Mike Parado, yes.
Leo?
Leo Negron Cruz, yes.
Francis Anthony's yes. So please convey that to the staff and let them know that it is part of the public record that we appreciate their work on that.
And the accreditation board doesn't ever ask for interaction with the Board of Health?
Through the chair, they do. We actually had Madam Chair Fran, as well as one of our members, Leo, participate in the site visit. They asked for 2 individuals to participate, and so we were able to have them involved in that site visit.
That's good news. Thank you.
You're welcome. Okay. Day of Remembrance observance that actually occurred yesterday. We actually had an opportunity to participate in that and remembering individuals whose lives have been lost as a result of road traffic violence. You all are probably aware of DPH's longstanding involvement and commitment to really getting to Vision Zero around road traffic and safety issues within our community. So we had an opportunity to participate in that yesterday and support the families and friends and communities here in Worcester who have been impacted by road traffic violence. The team continues to work on several grant applications, continue to bolster our overall work in the community and looking for funding opportunities. We do have one announcement on the way, and so once that's made public, we'll share the details on that. But just to know and let the board know that we've been doing a lot of great work through our finance committee as a division, and we're super proud of the work that's happening in that space. As we continue to take care of each other and taking care of those who are taking care of the people, we are always looking out for ways to celebrate staff and contribute to overall staff wellness. And so some things coming up for the holidays are door decorating contests, Yankee swap, some potlucks are going to be thrown in there in between. But we like to have fun here at DPH as well. Public health nursing, vaccine outreach opportunities and efforts. We've had thus far 3 Head Start clinics just in this last quarter, 3 vaccine and tabling events at the food pantry. And we continue to look for and continue to have other opportunities within the community to provide those services to individuals who are uninsured or underinsured. The next slide highlights just a reminder to the board. When we look at our overall strategic priorities and SAFE 2.0 and what is supposed to be sort of under the supervision or oversight of the board, we have the box that's in green. We've been able to have our data research, epidemiology, innovation team come and present on some of the work that's happening within that in that space. Tonight's dashboard was an example of some of that work. Our FinCom or Finance Committee will be presenting at some point before the board as well, and along with our Training Committee, Wellness Committee, and Public and Safety and communication team. So over the coming months, we'll make sure that the work that's happening in those individual committees are highlighted. On the next slide, we'll move into WDPH services and programs. These slides will look familiar to you because we shared these back in May of this year during one of the Board of Health meetings. But what I'm doing here is just highlighting what you have seen come before you as it relates to program services. So I mentioned the Data Research and Innovation Group. And I highlight the tobacco prevention, which falls under our community health office. You see Kyle and the work that's happening there often, so I feel like you have a good pulse on that. In the month of January, we'll be having our built environment office come and present on some of the work that's happening there to get feedback from the board. And that some of the work that comes out of that office is that day of remembrance that I just mentioned. So looking at ways to create safer environments for our communities. Public health nursing, you continue to keep a pulse on that. And so we're doing good in that space and keeping the board abreast. Our emergency preparedness group, you have not heard from them yet, but you will in the near future. Environmental health and ISD, you had a chance to hear from them last month and then again tonight. And so we're doing well in keeping track of all things related to environmental health and ISD. And we'll continue to do that on a quarterly basis. In our administrative and business office, you don't necessarily have to hear a report from them, but they keep us going in the background. We can't do what we do without them. The next slide really is just to try to give us a recap of where we've been and then sort of where we're going, a little bit of a timeline. I know this is something that we've been trying to work on, sort of organizing ourselves around what will come next as we consider and prepare ourselves for that August report that the board will be required for as far as it relates to the SAFE 2.0 new regulation to submit on an annual basis. So this just shows, what you all have seen thus far up to this point, and then what we're aiming for the next 2 months to have come before the board. So in the month of December, our hope is to be able to bring our training committee, which will be able to report out on things like our workforce development plan, our training efforts, and really making sure that we have a way in which we're equipping staff to continue to do this great work in the community. And then in the month of January, we'll look to have our built environment team come and present to the board, along with other items that we continue to have on the standing agenda. So just wanted to try to give a little bit of a snapshot there. I won't spend a lot of time on the last page, but just as you all are aware that the government has reopened after a 43-day shutdown. Notably, what some of the overlap in terms of public health items, $177 billion in funding for SNAP, and $8.2 billion for WIC and reimbursement for both the SNAP and WIC contingency reserves to account for expenditures during the shutdown was included in the bill as the government worked to reopen the government. We also have the ByHeart baby formula recall. Again, just on a national level, this is something that came out recently that we think it's important for the public to be aware of. This is organic baby formula recalled all its products, so nationwide at the federal health regulatories found botulism infections in 2 or more infants, bringing the number of reported cases to 15. So a number of these infections were found in Arizona, California, Illinois, Kentucky, Minnesota, North Carolina, and a number of other states, not including Massachusetts. But just aware, there have been no deaths while all cases have resulted in hospitalization. So some of the symptoms include poor feeding, droopy eyelids, weak muscle tone, difficulty swallowing, breathing problems, among others. So if parents or caregivers are aware, or you have formula ByHeart baby formula, that you should not be using it and to discard of it. And so it's just something that we want to make sure that the public is aware of. Okay. I And what remains in the packet is just an appendix that will capture all of the previous motions we had that are completed to date. So that will be our way of keeping track of those. And with that being said, that is the conclusion of my report. Thank you.
Any questions, Leo, or comments? Leo, Mike, Gary?
Just good work as always. Department is really
you.
functioning well, so we thank you for that.
Thank you.
Okay, let's try to get back to the first Monday of the month, meeting on the 1st of December, which is a short period of time because we moved this back a couple of times. So that would be December 1st. Is that going to work for folks? Okay. And items for the agenda, would you be trying to get the ORI folks in then? Okay.
Yes, that would be the aim. So we'll work with the office, DEI, to see if that can be arranged.
Okay. Thank you very much then. If there's no other items, I'm looking for a motion to adjourn.
Motion to adjourn, Madam Chair.
Thank you, Mike. Is there a second?
Second.
Thank you, Leo. All in favor? Gary?
Yes.
Okay.
Yes, Mike Parado.
Thank you very much.
Happy turkey.
Thank you.